Good afternoon. I welcome you all to this fifth course of JCOT with IGO on research and publication. I would be speaking on why and where to publish. It's a famous saying that if you do not publish, you perish. But I would say that nowadays, if you publish, you can prosper. So it is very important that you think about publishing your research in future. Why publish is a very big question, which most of the clinicians ask in their mind. Publishing is important because writing a scientific article is one of the major and final product of all scientists, and the highest value of research is reached when the scientific information is published as a material and become a part of the world fund of knowledge. There are several advantages of publications. It gives you personal pleasure and sense of satisfaction and achievement. It provides an additional line to the CV, which is very important for younger generation of people. It helps to share ideas and results with the colleagues, and it leaves a record of your research which can be added to by others in future. It also gets your name in that field of research and build your academic reputation. It may help also your institution in improving its ranking, and it's overall an important career step for you. But research is usually considered repulsive by most clinicians, but once a research is published by any clinician, then publication becomes addictive and they would like to have more and more publication in future. And hence, you must try to do a couple of publications and then you see how you become addicted to it. There are, however, several barriers to publication, and the most important, most common is the mindset. Most clinicians feel that it is not my cup of tea because I'm short of time because of my practice. There may be language-related barriers that springs to mind and that they stop writing. It is hard for most clinicians to communicate your scientific ideas and work to your peers and other people because it opens you up for potential criticism, which is difficult to accept by most of us. But also there are advancements in research methodology, so simple research or basic research is not getting published so easily these days in the journal, and more complex research like RCTs and meta-analysis are more commonly published. Writing is difficult because there may be language barriers, and one is not used to writing scientific knowledge that they may have so easily. But not only writing is a skill, but getting published is also a skill, and not all writers are always published. The rejection rate in most journals is around 80 to 90%. The research that you are trying to publish may not have a new or sufficient scientific interest for a good journal, and experiments do not always work. However, it has been seen that until recently, positive results were easier to publish, but now it is a common practice to see that a lot of researchers are publishing their negative results also in the journal, and editors and reviewers actually acknowledge any negative results that may be associated with your research. So don't be afraid of sending any negative results for publication. Several journals have specific requirements which may be difficult to meet by individual authors, may be another cause of not getting published. But there are several tips and tricks that I would give for clinicians to publish. And the first and foremost is that one should develop an aptitude and passion for research and publication. You must also learn to identify your jewels. By that I mean what may seem to be rare to you may actually be rare for the world. So if in your practice of 25, 30 years, if you have come across with a complex case or a rare case that you have not seen before, read about it, then it may be rare actually, and then you must investigate, and if that's so, then you can send it for publication as a case report or case series and so on. You should develop the habit of reading regularly, and the easiest way I find is to enroll with various journals for their table of content to be sent to you on each publication through email, and that helps you to develop interest and be aware of what's being published in the recent past, and then you can choose some of the topics of your interest to read in more details. Those who are new in the field of research and publication should find a mentor to help you and guide in research and publication. There are several reviewers and editors that you can contact for help. One must know what is a strong manuscript and should try to make the manuscript accordingly. It should have a novel idea with a clear message which is useful and exciting for the readers. It should be presented and constructed in a logical manner as per journal requirements. The reviewers and editors should be able to grasp the scientific significance of your research easily, because research, the reviewers and editors are all busy people, and they have to understand the concept and the contents of your research quickly to make an early decision. There are several journals available where you can send your research, and finding a suitable journal is also an important part of publication. It is based on the theme of your paper and the contents of your paper. You should also consider the audience and readership that you are aiming for, and also the quality and the reputation of the journal in which you are likely to send your journal by its impact factor and H-index. And there are several now online help that is available in the form of Journal Finder and Suggester, which is available on publishers' website like Springer, Elsevier, and so on. That helps you in finding suitable journal. If you put keywords and abstract in that format, the Journal Finder will suggest a dozen of journals for your article. So the clinical practice and research and publication should go hand in hand, and you should make it a habit to have good record of your cases maintained in a suitable manner. You should follow good clinical practice guidelines. You should incorporate research tool in your practice so that by scoring in different ways, so that in future, if you want to do any research and publication, it can be done easily. Every researcher has a career graph in their research and publication. Initially, you do research. This is my career graph. Initially, you do research because it is obligatory to get good jobs soon after your postgraduate examinations, and you do some research, then you go into practice and you do not have adequate number of patients or time because of practice, then the research goes to halt. And then once you are well established and have sufficient number of cases and experience, you start to write, and then you achieve a maximum once you are well established in your career. So there are several motivations for publication. It gives you fame, it gives you recognition by your peers. Some people can make fortune out of their research because of getting promotions, grant, application, research funding. But more than financial gains, it is also your responsibility to the society as a taxpayer-funded research to help contribute to the progress of the science in the form of better treatment options through your research for the present and future patients. But most clinicians have this problem that they do not want to learn new things because they are quite happy what they have already learned. And the greatest enemy of knowledge is not ignorance, but it is the illusion of knowledge. So if you want to learn newer things, you must first unlearn what you have already learned and then relearn new things. And that's how you can improve on your experience and learn newer things. There are several pitfalls in regarding research and publication because it takes time, but I must tell you it gets easier with the practice, and if you publish a couple of papers, then the future ones are easier to publish and write. So don't wait any longer and start writing the paper that is in your mind, because then you can do it quite easily. So to conclude, I would say that balancing clinical practice and research should be done. Publication is an art, and that needs to be cultivated individually and comes as you start publishing a few papers. The clinical practice is best coupled with research and publication, and research has not only become an optional thing now, it is mandatory or obligatory for most of us to enhance in our professional career and promotions. Thank you for your kind attention.